Welcome to Newsmax TV. I'm Kathleen Walter. With us now is Romina Boccia, Senior Analyst and Fellow in Federal Budgetary Affairs at the Heritage Foundation. And Romina, welcome.
Thank you.
Well, the nation this week marks the 78th anniversary of Social Security. We've all heard the reports that unless changes are made, Social Security will not be able to pay full benefits after 2033. In your view, is the situation that dire, and can Social Security make it to 100?
Social Security can make it to 100, 200, and even last much longer than that, but we do need reforms. So the situation is as dire as it is. In fact, it is even more dire because Social Security is considered to be legally solvent for the next 20 years, but what you need to keep in mind there is that the trust fund is full of IOUs, so that spending still represents a liability for taxpayers. It's already factored into the national debt. So the cash flow deficits have started already, which is why reform is urgent now, and we should not wait until 2033.
Now, Congress is preparing for another round of budget battles in September, which is when current funding for government operations runs out. Liberals have focused on increasing Social Security payroll taxes on the wealthy to solve the shortfall, while conservatives have looked at means testing benefits and raising the retirement age. In very simple terms, can you compare and contrast these two different proposals and explain which is a more viable solution?
If we think about Social Security's original purpose, it was to protect against old age poverty. And now 78 years later, the program looks entirely different. For example, we're paying benefits to about 47,000 millionaires a year, while other seniors who've worked their entire lives, paid into Social Security, still live below the poverty level. So how can we return Social Security to fulfill this promise of protecting against old age poverty without burdening younger generations with higher payroll taxes? So this proposal to raise taxes, there are a couple of problems with it. First of all, it's a short-term fix. It buys you about 11 more years of good cash flow years, but after that you're back into deficit years, which is where we are now. Plus, Congress spent any surplus that Social Security collected in the past on other programs, so we can expect the same thing to happen now. So it would allow Congress to spend more now, but it wouldn't help Social Security over the long term, and that's why benefit reforms are necessary, so we can preserve this promise to keep seniors out of poverty and do so in an affordable and sustainable manner.
Now, Representative Paul Ryan's plan to partially privatize Medicaid by providing seniors with a subsidy to help them purchase private insurance or traditional Medicare. How do you view this plan? Could Paul Ryan's plan work?
I don't think privatization is the right term to use here. It's called a premium support system, and this is already implemented at the federal level. Federal employees have this kind of option where they have more choices concerning their health plans. So it's expanding something that's already working well for members of Congress and federal workers to all Americans. Medicare has very deep financial problems, and they're only getting worse over time as more and more baby boomers retire and healthcare costs have skyrocketed. So it is actually a proposal to allow seniors more choice through premium support. The health coverage still would be regulated, so in that sense it's not full privatization, but it would cover seniors' needs, but they would have more choice, and by bringing in more competition it would lower costs, which would make Medicare more affordable and also lower the burden on taxpayers in the future.
And President Obama has proposed reducing benefits by changing the way inflation is calculated. He's proposing a new measure of inflation, the CPI, the Chained Consumer Price Index, that would reduce the amounts Social Security pays seniors over time. Seniors have reacted very strongly in opposition to this. What do you make of this proposal that was included in his budget?
I think there's a lot of misunderstanding about the chained CPI. What it does, it is a more correct measure of inflation. Currently, many seniors are receiving windfall benefits. They're receiving higher benefit increases than are necessary to make sure that they're whole, that inflation doesn't reduce their benefits. And that really is the purpose of a cost of living adjustment. By having this excess benefit now, it is draining the program sooner, which is bringing about the date when Social Security will no longer be even legally solvent, bringing this about even sooner. And that would mean across the board benefit cuts for all seniors by about 23%. And that is really scary because that would also hurt those seniors who are very old, have maybe outlived all of their other savings and are now completely dependent on Social Security. So the chain CPI is a good proposal to correct the current flaw in the measure of inflation, make sure that seniors' benefits are protected from inflation, but do so in a way that also helps us improve Social Security's longevity.
And if you were to advise Congress about how best to reform Social Security, what would you tell them? And are there any other options available for Congress to consider for solving Social Security and Medicare's long-term fiscal problems?
On Social Security, I have 3 reforms that Congress can implement right away. The first one and the easiest one to do is, of course, the chain CPI, which the president has shown his support for. That would resolve some of the financing challenges while protecting seniors from inflation. But beyond that, Americans are living much longer now, and the program has not adjusted to that. And so Americans tend to draw benefits for much longer. One fix is to increase the early and full retirement age and then index both to longevity, so we have a predictable way of knowing, as Americans live longer, how the program will adjust for that. And the last one is that we really ought to think about how we can target benefits, the scarce benefits that we have, more directly towards those seniors who have the greatest need. And that means bumping up some seniors' benefits who currently live below the poverty level with a flat benefit for those eligible seniors, while seeing that those who can do without, millionaires, their benefits should be phased out over time.
The Supreme Court ruled and struck down the Defense of Marriage Act back in June. What impact will administering benefit programs to same-sex married couples have on the program?
I haven't looked at that issue closely, so I can't tell you, but because it's still a small minority of couples who engage in same-sex relationships. In that sense, I don't think that the impact will be huge.
All right, last question for you. The Social Security Agency doesn't have a commissioner now, hasn't had one for a while. Does it need a commissioner soon, considering the funding challenges that the agency faces?
What's really important, I think, is that Congress, lawmakers, and the president get together and stop pretending that Social Security is fine, that it's solvent for the next 20 years, and we don't need to do anything right now. So with a new commissioner or without, it is really important for lawmakers to understand that the longer we wait to make these important benefit changes, to make sure we preserve Social Security for current and for future generations, the more drastic those decisions will have to be in later years, the more aggressive benefit changes would have to be made. If not, that automatic benefit cut is to kick in by 2033. So we cannot wait. It is not an option to continue to procrastinate. It's very important that Social Security be reformed now.
All right, Romina Boccia of the Heritage Foundation, thanks for joining us today.
Thank you.
And thank you for watching Newsmax TV.